My name is Kimberly Cato, and I'm the registered psychotherapist and CEO of True Roots Counselling Services, where we purpose to come alongside people who are overwhelmed and perhaps blindsided by life altering circumstances and give them tools and strategies designed to help them, you know, transform their trauma into triumph. Hi, thank you. Welcome. Um, Welcome everyone to our second installment of Black Mental Health. And this time we're focusing on shattering shame. Thank you so much for coming, for joining, for um, lending your energy to this space. I'm going to share my screen. Ah, yes, and I'm going to click those things so that they actually work. Um, oops, and hopefully, hang on, there. Can y'all see?
Yep.
Oh,
Yes.
oh, and this is perfect because then it gives me the, sorry, little thing when people want to come in. Um, okay, so this is the Black Mental Health Shattering Shame. I'm from True Roots Counseling Services. Can't even say from. It's my agency that I started a number of years ago, but I'm delighted today to be meeting with all of you and beginning this journey. Um, well, continuing this journey actually that we started before. But before we really officially start, I wanted to just touch on this particular slide, just some Zoom etiquette, to stay muted if you're not talking and to avoid talking over people if that's at all possible. Um, and then also to use the chat and oh, and to use the chat to ask any questions, but know that there are designated periods throughout this 2 hours that we will be stopping to solicit any questions. So write them down, but remember to put your hand up and ask at the appropriate time as well. Um, and then also, you can put your hand up and raise your hand. I discovered actually yesterday that the raised hand is actually in the, I think it was in the chat. No, it wasn't in the chat. It was in the attendance slot, I think. Anyways, it was for me yesterday in this one Zoom that I was in. And I was really quite surprised because I didn't know where that hand was. Um, and then understand that this is, this is a safe space and just respect the people who are here in and amongst you as we share and kind of dig in to what mental health looks like for us, um, and how it has impacted us and how it impacts the Black community, on uh, like an overview of how it actually impacts the Black community. One of the things that led me to have this particular discussion is because really and truly, as a therapist, I see so much silence instead of openness when it comes to mental health. And I really thought that it's time that we really do address that. Um, so that's it for me at this point. I'm going to um, use this moment to I'm going to actually change my view to speaker view so that I can, when I share the screen next, we can we can focus in on the people who are speaking specifically. So I wanted to share my land acknowledgements as people keep entering. Bless their hearts. And so while I share this, if you just take a pause for a moment as we just acknowledge the land that we're on. And I know that we're coming from a whole bunch of different areas in the GTA, in Hamilton, as far as Niagara, and all over. But I'm speaking specifically from the place in which I sit, and I'm in the Halton region. So my land acknowledgements, this land acknowledgements, it starts from here, but fortunately, just given the fact and the reality of the land that we are actually standing upon, it does have a pretty broad reach. So we acknowledge that Halton is rich in the history and modern traditions of Indigenous people. Halton is on traditional lands of the Haudenosaunee, the Wendat, the Attawandaron, the Mississaugas of the Credit, part of the Anishinaabe Nation that extends from the Niagara Peninsula across Hamilton, Halton, Toronto, to the Rouge River Valley. We acknowledge the fact that this land was deceptively negotiated out of the hands and the lineage of those who first loved and cared for it. We thank the Mississaugas of the Credit First Nations for welcoming our presence on their traditional territory. And we also recognize and embrace the enduring presence of Indigenous people on this land. And with a humble heart, we give genuine thanks for the opportunity to gather together in this manner today. And so for the next few seconds, at least 30, can we just take a pause and think deeply about where we actually sit and to whom we genuinely need to give thanks. Thank you. Thank you very much for that. I'm going to share my screen and reach over to Coach Nikki, who's going to lead us in an opening meditation.
Thank you so much, Kimberly. Thank you. Thank you, everyone. And I am grateful to be here, and I'm grateful to be in your presence. So thank you all for your time today. Over the next few moments, I am going to be guiding you through a breathwork meditation that will help to ground us and center our attention to the present moment. I imagine that everyone is coming from various walks of life, various days, maybe rush to get here. So just taking a minute to reconnect with ourselves through our breath. And a brief disclaimer, if at any point during this exercise you feel uncomfortable, just feel free to stop. There is no obligation to participate. Okay, so this breathing technique is called the 557 breathwork activity. And it is helpful because it moves us into the relaxation response. As the parasympathetic nervous system, aka the body's rest and digest response, is activated. So when we are feeling stressed out, we activate the sympathetic nervous system, and that's our body's fight or flight. Our bodies become more tense, our heart rate speeds up, our digestive system shuts down, our immunity is lowered, and all of that jazz. So engaging in breathing exercise helps to counter that. Historically, this activation served us, and it still does to this day, to be able to get through threatening situations. So being chased by a bear, for instance. But unfortunately, our bodies cannot always distinguish between an actual threat, such as being chased by a bear, or a perceived threat, such as running late, being yelled at, getting stuck in traffic, etc. So I'm just going to be guiding you through this breathing exercise. And as we're doing it, I want to ensure that you are engaging in diaphragmatic breathing. So you're using your diaphragm to breathe. A lot of the times when we breathe from our chest, and it is shallow breathing. So breathing from our belly allows us to take in more air into our bodies. Okay. So we are going to inhale for 5 seconds, hold your breath for 5 seconds, and then exhale slowly for 7 seconds. Ready? Inhale for 5, hold for 5, exhale for 7. We can continue for 2 more rounds. So we're going to inhale for 5, hold for 5, exhale for 7. One more time. Inhale for 5, hold for 5, exhale for 7. Once you are ready, you can return back to the room. And that's the exercise. I hope this helped you to feel relaxed. Thank you for participating.
Thank you very much, Nikki. Thank you very much. So Black mental health, shattering shame. This, as I said, is a ROOTS Counselling Services facilitated discussion, genuinely to raise the awareness and shatter the silence and shame of mental health issues within the Black community. And my name is Kimberly Cato. I'm a registered psychotherapist, CEO and founder of ROOTS Counselling Services, where our mantra really is to transform trauma into triumph. And of course, so now we're going to introduce the panelists and all those who are actually going to be speaking with us today. And Alethea, she was the panelist when we did our first Black Mental Health Day discussion back in March 1st. And she's come graciously to introduce the panelists for today. And so I'm gonna toss it over to you, Alethea, and to introduce our first panelist.
Thanks, Kim, for having me. And I want to say good afternoon to the panelists and for all the guests that attended this afternoon. And my name is Alethea, and I will read the guests that are on the panel this afternoon. Nikki Reed, a certified health, life, transformational, and master coach. She helps women survivors of suicide find solace by creating safe spaces for them to be seen, be heard, and feel like they belong so that they can be confident in themselves, mind, body, and soul. Through yoga, aromatherapy, mindfulness, and various alternative medicine practices, Coach Nikki has developed a holistic approach to managing mental health within the Black community. Welcome, Nikki.
Thank you. Thank you so much, everyone, again, for having me. Thank you.
Our next panelist, Michael Nanakobrena Asamedo Opoku Forfie, a counselor, coach, consultant, and writer who has worked in the mental health since 1998. With an MSc in therapeutic counseling, he has supported men, women, and transgender people in a variety of settings and sees counseling as cooperative, expressive, moving art. Welcome, Michael.
Thank you. What a wonderful introduction. Really pleased to be here. Looking forward to this discussion.
Thank you.
Our next panelist, Janelle Levy, a writer and journalist who focuses on social inequality and social issues within pop culture. She has written about mental health for Viacom's Logo, Condé Nast's Them, Flair Magazine, and HelloGiggles.com. Janelle is passionate about advocating for equality on and off the page. Her work has also appeared in USA Today, Global News, Teen Vogue, and Shondaland.com, amongst other places. Welcome, Janelle.
Thank you for having me.
Thank you for being here. So this is a moment in which if there's any questions or comments, or if any of the previous three panelists who've been introduced thus far, whether Nikki, Michael, or Janelle care to share any details about what brings you here to this particular table and what brought you to focus on mental health.
If nobody else wants to go first, I'll go first. I came across a quote a few years ago by Gandhi, who said that poverty is the worst form of violence. I came from a, I would say, disenfranchised, poor place. Grew up as a Black son of an immigrant to London, and really struggled with my identity. But counseling really offered me a way to process various different experiences that I had gone through. I have a disability, I have multiple sclerosis, and I'm a survivor of physical and sexual abuse. My writing helps me to process and release my pain and my shame. I think that's why I wanted to be a panelist on this particular topic.
Yeah, and I appreciate your openness, and I'm very grateful for the, you know, when we first started communicating and you shared some of your writing, I was really touched and and empowered, actually, when I had the opportunity to read some of the things that you've written. And so I really genuinely appreciate how you've processed the trauma you've endured and how you give back to the community to empower people to overcome obstacles and hurdles in their own lives, and genuinely transform their trauma into triumph, as you yourself have. So I'm very grateful that you've come and that you're sharing. Thank you. Janelle, Nikki, do you, either one of you, have anything that you want to share, or do we want to pass over?
I'll share quickly. I just want to say that one of the reasons I've always been interested in covering mental health is because it often intersects with my work of covering social inequality as a journalist. One of the things that I've learned is that often mental health never really just stands alone. The stigma of mental health can prevent people from accessing healthcare that they need. Also, when people experience particular discrimination, they're often prone to developing anxiety or PTSD. And so all of that, we can never separate that from social inequality. And I think that's important to note, especially within the Black community. And I will just say on a personal level, it's also something I relate to, as I also live with a mental health condition.
Thank you so much for sharing. And you're exactly right. Yeah, the intersectionality of mental health, particularly within the Black community, and the shame that then causes us to remain silent and stuck in silos instead of accessing services and resources that may be, though inadequately available, they are available should we have the strength and the ability to ask. But there's so many layers and barriers to us stepping out and asking for those resources. And so, yeah, I appreciate what you had to share about that.
I'll quickly speak as well. What brought me here really was my personal experiences navigating mental health, and I'm sure we'll talk more about this later on in the panel discussion. But I am also a survivor of various abuse, mental, emotional, and I am a suicide attempt survivor as well. So I know firsthand how lonely and isolating it is, and how much shame I carried for years, dealing with depression, anxiety, and things of that nature. And one of my mentors shared a quote with me, and it is, "We don't heal in isolation, but in community." And since I started sharing my story with other people, I have had nothing but support, people resonating with it. So to tie this all back in together, thank you, Kimberly, for bringing us all together. This is a much needed discussion. While my healing journey with shame is an ongoing thing, I believe it's going to be a lifelong process. There are certain things that I've been able to work through, and I am sharing what I can with other people. And if that means that there is just one person who can receive my message and know that they are not alone, and that they are loved, and that they are supported, then that's all, just one person. I was in a place where the only way, I thought to get through it was out, and that's not true at all. So to be able to create that safe space and to provide for others and let them know they're not alone. This is it's a part of the human experience, navigating personal, generational, intergenerational, etc.
Yeah. Thank you. Thank you so much for sharing that. And you're absolutely correct. One of our driving needs as human beings as human beings is a set that need to feel connection, to feel like we belong somewhere. And mental health genuinely has the ability to isolate people into thinking that they are all alone, that there is no one else that can understand or accept them, or appreciate the things that are happening or the things that have happened. And that isolation and that silence and subsequent shame is the thing that locks us away from community. So I really appreciate what you shared, Nikki, in that the developing of safe space and creating those spaces and that awareness for people that they are not alone enables them to feel that sense of community, which really genuinely is the place of healing. So I thank you genuinely for saying that.
You're welcome. Thank you.
If anyone who's attending had anything that they wanted to share and contribute, this would be the time.
Okay, good afternoon, everybody. I don't know, I came across this on Facebook, and I decided to give it a shot and see what, a listen, not a shot, give it a listen. So that's why I'm here. Mental health runs in my family, and recently I feel like it's been like affecting me more and more, depression-wise, and I try admitting, opening up to people that I need help, but I feel like it's falling on deaf ears, and at more as mental health becomes a topic of public discussion. I don't know, I feel like people think I'm using it as a crutch or something to get by for my laziness, and I feel a little bit alone in that regard. So yeah,
thank you very much for having the courage to come and to share. And you're not alone. You're not alone. And I know how difficult it can be to speak our truth and get the help that we require, particularly when we knock on doors and they're just not the right doors. It's not the right person. It's not a safe space. But I encourage you to keep knocking and to keep reaching out, and to know that you will find the right door and you will find the help, and that there is a light at the other side of this period of darkness. I genuinely appreciate you having the courage to come and share. Thank you. Is there anybody else who wanted to share at this point?
Hi, my name's Marcia, and yes, I'd like to share. I'm interested in mental health because of the fact that our experiences impact us, whether we recognize it or not. And there's a lot more interest being taken in within neuroscience, the pathways, the psychological impact of trauma. And as I work with families. I'm a director of family services, and we work with families that have child welfare involvement. And the trauma that I see when separation happens. So many times at a table discussing, I'm asking, is there no grief and loss support removing children from care, when you're traumatizing parents because a teacher has called and the parent gets a call at work or wherever they may be and they had no clue what's happening, they're traumatized. So I see the adverse effects, mental health, when a child is just suddenly ripped out of a parent's care, a caregiver's care. And it's not really being addressed. And my concern is the long term. And so we see a lot of street involved youth that have been involved in the child welfare system, and it's a cycle that is not being addressed. So being in a position to work with families, and predominantly with Black families, in minimizing or preventing, doing preventative work as well as restorative work, I want to be able to understand that more within our cultural context of the ongoing oppressive construct of colonialism within the child welfare system, right? And being in a position to be up close and personal to kind of break that cycle. So really understanding, and then even just looking at my own life with intergenerational trauma around being a Black woman. I was born in Canada, but I experienced a lot of racism in the public school system, just within different sectors of society, and really working through my own trauma so that as I'm working with Black families, not being triggered, not wanting transference, but being, while I'm simultaneously supporting families, that I'm also at the same time looking about my own well-being and self-care. And as a mother, not repeating it. So wanting to interrupt the interruptions of our Black community. So I'm really wanting to learn and hear from professionals, because I'm in social work. I'm not a psychologist or a psychiatrist, so it's not that learning that I'm wanting to glean from this.
Excellent. Yes, thank you. Thank you so very much for sharing all that. And especially trying to interrupt personally and professionally the intergenerational trauma and the continuation of colonial sort of separation and division amongst our people. I appreciate where you are and the impact of the work that you do, and your heart's desire to see change. I appreciate that, and I thank you for being here. I'm cognizant of the fact, Alethea, that you're going to be leaving us soon. And so if we could continue in introducing the panel, that would be exceptional before you leave.
Thanks, Kim. It was such a rich conversation to start off with. I want to introduce Nicola Blair, a qualified drama therapist and picture exchange communication facilitator, PEC system, wonderful, practicing over 22 years. Nicola facilitates individual and group intercultural therapy. Nicola is the founder of Act On It Therapies. I'm sure you saw her on CTV. That specializes in psychotherapeutic drama therapy. She is also an advocate for intercultural therapy in her practice. She is a public speaker, a public service change management consultant who has actively worked with Halton Region Catholic Education Board for over 6 years and formed the first Equity, Diversity, Inclusion, and Anti-Black Racism Committee in the Halton region. That has now been developed as DARE, rolling out across the Halton Region School Board and beyond. Congratulations. Welcome. Welcome, Nicola.
Oh, thank you so much. Thank you for having us. Thank you for the opportunity to gather together to talk about such a pressing issue. What brought me to therapy is I came to Canada many years ago as an exchange student and got working with the Pandora's Women Group in Alberta. And then I realized at that time they called it the Native Criminal Justice System. I understood how against or how inconducive to the well-being of the Indigenous population it really was. And that really inspired me to go back to the UK and really get involved in social work. So that led into social work several years later in management. I then went into therapy, and it was through my work with the Dennis Hill Foundation, which is based in our Maudsley, Bethlehem Hospital, all the history of mental health, it was based there. And I recognized the sad reality that I am with a multidisciplinary team, and when my clients kiss their teeth, they are going to be heavily medicated because of fear or because of I'm not aware of what that expression actually is, and took it as intimidation. And that fueled my passion to really work with with communities that are really up against it, and that includes the Black community, young women, and communities that are human trafficked. And so my passion in coming back to Canada several years later, I've been really involved with addressing an issue that was prevalent to me. My children experienced firsthand racism. The school was called out. I raised it out on social media, and that birthed a committee. Now, since leaving the school, the committee and the school have gone on and developed the IDEA program, which I'm proud to see something positive come from such a negative experience. And so I can only say it's about understanding your rights. It's about advocating. It's about understanding the pen and paper and the power of it, especially when you're in this community. So I'm here to talk about the cycle, the disproportionate numbers, and really is about looking at how we can integrate some of our quality assurances across other platforms, which is mental health. So I'm passionate about the subject. Thank you for having me, and thanks to True Roots for really bringing this to the forefront. Thank you.
Bless your heart. Thank you so much. Thank you so much. Thank you for all that you've done, and for all that you're doing. I genuinely appreciate the fact that you're here, and we'll delve into it a little deeper. Christian isn't here yet because we had a conflict. I keep saying we, but it was really me. We had a conflict because he's in California, so there's a difference in time. So he'll be here probably shortly, actually. And so we'll leave that introduction to later. And if you could read Medina's introduction, that would be awesome, Alethea.
Definitely. And I remember Medina from the last event that we had. So it's great to see her again. Medina Jones, the co-founder of Halton's Black Student Union, a member of Halton Black Voices, and a grade 12 student in Oakville. The group is passionate, and she's a passionate community activist working to create positive change alongside like-minded individuals. Medina would like to nourish an environment where community care is encouraged alongside self-care, and where Black people can be self-determinate and able to ask for help when they need it. That's wonderful. So welcome, Medina.
Excellent.
Thank you. I'm really grateful to be here and listen and learn from all the conversations and maybe also participate. I'm definitely the least qualified person here. But I want to share what I can. Thank you for having me.
You're not the least qualified. Everybody is qualified. We come here with our hearts and our experiences and our exposures. And given the fact that you're grade 12, you're stepping out in a direction that I didn't have the courage to step out in when I was in grade 12. So I applaud you for stepping out in the manner that you have. Welcome. So any questions, comments, or thoughts from any of the panel members at this point?
Yeah. How did you overcome shame, your shame, or your mental health addictions early?
Me specifically, or who specifically?
I mean, specifically, how did you overcome your mental health shame?
Okay.
To any of the
I guess I can answer, and then we can all chime in as well. Overcoming mental health and the sense of shame, it really is it's a daily pursuit. It's not like something that you wake up and you're able to do every day and in every single circumstance and every single scenario. For me, anyways, I know that there were times when I was younger that the obstacles were too great for me to actually step out and say, I have a problem. There were a number of different barriers and reasons as to why I didn't. Sometimes they were as simple as just not knowing who to speak to. Other times it was not really understanding what was happening to me and not being able to bring words to feelings, because in my family it's things that we just didn't talk about it. We didn't talk about what we were feeling or what we were thinking, really. We were just expected to get along, just to get from one day to the next, and not really meditate on what was happening in any one single particular moment. And so it was when things became an explosion, a crisis, that you addressed it. And you addressed it because somehow the school got involved, or the neighbor saw something, or something external brought it to the family and then made it necessary to be addressed. And but at some point in my life, I started owning and identifying that there was a problem, and that I actually needed help, and that I wanted help. And when that shift happened for me, I was able then to step out of my comfort and not really care about whether it was okay in my family or not. I would ask for the help and seek the help that I needed. And oddly enough, the help that I needed really came from me delving into the work with a passion and a desire to help other people. And it was in the process of doing that, helping other people, that I was able to garner things for myself and realize, as I'm growing in education and awareness, that these things can be utilized by me as well. And that was a turning point for me. But to be honest, every single day is a turning point in shame. Every single day opens another door for me to be a little more bold and a little more specific and a little more determined to get the help that I need. Yeah, every day. Anybody else?
Yeah, I would like to second that. I think it is. I think we are, when clients or myself has experienced moments of mental or disturbing thoughts or whatever, it's the fact that we actually go externally for acceptance is the default, when in fact, if only we can, once you become comfortable with your own reality, recognizes the cause and the triggers, you actually start engaging in what is it that I need from me. And it's about putting yourself first and foremost at the front, as that's the most important thing. And it is a challenge and it is very hard to do, but it can be done, because when you put yourself first and foremost, the voices of I'm not good enough, it's not good enough, I'm a failure, I'm letting people down, I'm a mess, and all the negative thoughts start to find its place because you're putting yourself in front and foremost. And so one of the major quotes that I've held on to in my life has been one by Irving Allen, and it says simply as, to love means to actively be concerned for the life and the growth of another person, period. So if I can actively love you as a person, the shame that I carry, the shame that you carry, I want to relieve you from it, because I'm more interested in your growth, your stability, your wellness. And that has got, and anybody that cannot embrace that is just not for you. And it's about getting the people that are for you in line with your path and journey.
That's excellent. Yes. Thank you. Thank you. Anybody else have anything to share?
I just wanted to share that for me, reading the book by Brené Brown, Daring Greatly, and then listening to an interview with Lisa Nichols by the Mind Valley host, Vishen Lakhiani, it was really clear that there was only one way that I was going to move beyond my shame, my personal shame about my body and what has been my experience, to a place of acceptance, and that was to bring it to the light. And I'm sure there's a video coming up where Brené Brown speaks about this specifically, but it's about that, not having that shame anymore where I have to hide it, is really, really important for me to move on beyond it and leave it behind.
Yeah, yeah, that's excellent. And you're right, we will be sharing Brené shortly. But I appreciate that. Oops.
Oh, sorry. I just wanted to jump in and share. I agree with everyone here in the sense that getting rid of shame is a journey. I think one of the things that I often think about is that when there's shame, that's really what takes away our power. I think especially thinking about that as Black people, even when we were enslaved, part of what they were doing was not only enslaving us, but also trying to shame us, degrade us. And so shame is really taking away our freedom in a way. I think for me, how I personally worked through it is representation is huge for me. So realizing that there are other people out there who struggle with mental health, that I'm not alone in it. For me, even as a young person, seeing celebrities speak out, people who I admire, having friends who are sharing their experiences on Mental Health Day. I think even tools like social media, although social media can be a double-edged sword, I also think it is a platform for sharing, and that on certain days like Mental Health Days or in October, when people are sharing their experiences, I think those are some things that can make us feel less alone. And I think that's the biggest part of shame. Once you realize you're not alone in it, oftentimes that's the first step.
You're not. Yeah, man.
Sorry.
Can I share something quick?
Yes, you can, please.
Okay. Yeah, getting rid of my shame. I think, fear drove me, because fear of losing control. That's what drove me. I don't want to end up not having the power to do anything about it in the future if it gets worse or whatever. And I don't want anyone to be able to say, oh, why didn't he reach out? Why didn't he do this? Right? Before it gets to something drastic, So that's the fear that drove me to ask for help.
Mm-hmm. Thank you. Yeah, thanks for sharing that. The fear of losing control is a really big motivator, oftentimes, yes. Thank you very much for sharing that. Does anybody else have anything they want to share before we move on?
The Tanzanian wants to speak.
Yeah, my name is Engineer Shangwe Mgaya from Tanzania. I'm sorry, here is midnight. It is almost 12 past 56 a.m.
Oh, wow.
Yeah,
Welcome.
I'm a mother of a 10 years autistic kid. But here the early intervention is not, it is not given priority, because even in the hospitals, the doctors, they are not aware of this challenge. So I became to know my kid when he was 4 years old, and I started to help him, but still we don't have schools, we don't have a lot of facilities. I thank God I met Sister Nicole. She introduced me today to participate in this wonderful session. I'm happy. I have learned a lot, and I need you, you to put your eyes on our country, because we need help. We have a lot of parents who have these kids, but the situation is not, good. Even the awareness is too low. People, they relate this challenge with witchcraft beliefs. And still, I try to raise awareness through social media and a lot of platform. And most of the parents, they contacted me, and I found I created the group in WhatsApp where we exchange a lot, of material, and we give ourselves updates about the services. So we are trying to make it, but things are not that much. Yeah, but I'm here to learn. I know that I will learn a lot, and I will help other parents as well, because even some of the parents, due to stigma, they hide their kids in their houses. So we have tried to expose some of the families, so that by counseling the parents. So we have the big number of people, but still we are struggling for the center. Thanks for this platform. I'm very happy to participate today.
Thank you. Thank you so very much for coming. We really genuinely appreciate this. And it's one of the burdens of my heart, actually, the amount of people who are shut in and pulled apart from community and from connection because of the shame, because of the stigma, because of the fear of losing control. And so anything that we can do to assist in that regard, we will continue to endeavor to do so.
Okay, thank you so much.
I'm going to share I already did, the screen, and sort of step into, the next area. And the question that this particular video that I'm going to share with you, I have to stop this to open it. What I want, let me just hang on. Get everything ready. What I want to share with you this particular video, and on the other side of the video, we'll have a conversation about, there it is, about the video. So, can you confirm for me verbally?
Look at the historical.
Can you guys hear this and see it?
Yes, can hear. Yeah, coming through.
Yes.
Excellent.
Experience of African Americans in the United States. You have to start with the experience of slavery and the vestiges of slavery in terms of the trauma associated with it. And I think that, Blacks continue to experience trauma in certain ways, and certainly with respect to those who live in urban communities that are infested with drugs or that are particularly violent. Those are traumatic situations that they experience on a daily basis. Certainly, as we've seen in recent events, interactions with the police can be, again, particularly traumatic. So when you talk about mental illness in the Black community, I think you have to begin with the experience of trauma and how trauma continues to abound in their experiences and in their daily lives. I think that what happens for a lot of individuals is that they suffer in silence with respect to having a mental illness. And so what I mean by that, in the greater society, there's certainly a lot of stigma associated with mental illness. It's sort of antithetical to the American ethic, which is to, be strong and courageous, to pull yourself up by the bootstrap, to weather the storm, etc. I think the second part of that, point is what's happening at the community level or the society level. And I think what happens is that within the Black community, I think that, again, that ethic about what it means to be strong and courageous is particularly pronounced because of trying to, combat those forces like discrimination or racism. And, it just adds to the burden of, sort of what it means to survive. And so then the person who's struggling with the mental illness is perhaps not embraced or, warmly accepted because of their struggles. I remember as a young person growing up, I used to hear about the person who was quote unquote sent down south. I used to wonder what that meant. And it wasn't until I got older that I became, more knowledgeable of the fact that that person was struggling with a mental illness or perhaps substance abuse. From a historical perspective, there's been a lot of emphasis in the Black community, particularly in Black families, on keeping your problems close to the vest in the home. You don't share what's going on with outsiders. No one can treat you as best as your family can. You bring all your burdens and your problems to your family. And if you do take it to any entity outside of your family, it's the Black church. The church is really important in the Black community. Make no mistake about it. It's a source of, sort of salvation and healing, and there's the whole collective support from, you get from your fellow churchgoers and that sort of thing. But I think also what has historically happened is that the church has been defined as the place to, sort of relieve your symptoms or to address your burdens. And so it stops there. And what I think needs to happen is that, first of all, I think pastors and lay ministers can be more trained in the signs and presentations of mental illness. But I think that the church could be sort of a triage unit, if you will, such that it identifies those who have needs, and it's that sort of first step and the sort of entree into care, but it shouldn't stop there. I believe that culturally competent care is critical to everything. If patients perceive that providers are inauthentic and do not care about their unique circumstances, then they're likely to be turned off. As a baseline, providers should understand the history of their neighborhoods, for example, or the history of the experience of African Americans and Latinos, such that they can put the clinical presentation into context and understand what unique factors are in play with respect to the clinical presentation and how that person is seeking to, survive and live in the world as an African American or Latino. And so I think that the onus is on the provider to understand that context and to understand what it means for that person to live in that context.
Yeah. I'm gonna jump over to our panel and ask, how does trauma, silence, being strong impact, or how has it impacted you? And or what is your response to the video that we just watched?
I'd like to respond to the video that we just watched. I completely agree with the points that he was making. And I also wanted to bring up something from some of my own work, which is that shame and particularly stigma with mental health can actually lead to death in the Black community. So a story I worked on in 2017 found that for gay Black men, they're more likely to die from HIV and AIDS. And it's not because of anything biological. It's because the stigma of mental health, of even being gay in the first place or being out, makes people not want to access healthcare, which in America is already very expensive. And so it's all of those barriers coming together all the time. And psychology researchers at the New York University have actually given a name to this. I wish I could remember. I think it's called the multiple, it actually draws on this theory of intersectionality, which is basically just that because we can experience multiple discriminations at the same time, they gave a different name to it. We experience a very specific kind of mental disorder that draws from experiencing possibly homophobia, racism, sexism at the same time.
Yeah.
Someone just said a multiple minority stress. That was exactly
That's right. Yes. Oddly enough, I was chaplain for about 14 years in Toronto, working with the HIV/AIDS community, and really genuinely was drawn into it because the organization that I was working with was actually founded based on a gentleman who stumbled into the church, who was completely estranged from his family and loved ones, and struggling for identity. Well, actually really struggling for connection as a result of the fact that he was gay. The family had just completely stepped away from him, and even in death wouldn't acknowledge him. And so this church wrapped themselves around him and established a hospice in his name and in his honor. And so I can genuinely relate to what you're saying about the suffering and the loss and the alienation that so many of our people have had to endure because their mental health, their life experience, and their issues have such stigma attached that they're not reaching out for the help. And if they do, they're ostracized. And so, yeah, I can relate to that. Thank you very much for sharing that. Anybody else have a response from this clip on the panel? Anyone else?
I can share. So many of the things that he mentioned resonated with me, and I have experienced personally. Shame it is, if we allow it to, it will really consume us. In reaching out and being viewed as weak or inadequate or incapable, I know there's that strong Black woman trope as well, that, you know, we need to carry the world, we need to carry our families, we need to carry everything. And it's like, who carries us, you know? And I know that there have been times when I've been told, like he had mentioned, to, like, you know, pull yourself up by the bootstraps. Like, I've been told to man up, you know, and just keep it going. And we don't want to bring shame to our families. So when we go to our families and those are the responses we receive, we're like, oh, okay. And, you know, for me, I grew up in a very Christian household. So this whole pray about it, yes, absolutely. It was take it to God in prayer, which, please don't get me wrong, I grew up faith-based. I believe in the power of prayer. But as a speaker in the video mentioned, like, that is a piece of the puzzle. Like, keep going, take it further, you know? So there, like I said, there was so much in that clip that resonated with me. And we have plenty of work to do in our communities. And I think a part of that is the lack of education. Like, I know when I first started to realize that I was experiencing mental health challenges, I was in university, I was really anxious, and I was depressed, and I got burnt out. I was working 3 jobs, going to school full time, and there was no like break or refuge. And even that in itself, like, you know, that I was working so hard because, you know, I've grown up with the, you are Black, you are a woman, you have 2 strikes against you, you have to work twice as hard. And I literally, like, worked myself into the ground. And I remember being burnt out and people around me not realizing what was going on. They're like, get up out of bed. And I'm like, I'm crying at 4 a.m. If I could get up out of bed, I would be getting up out of bed. And it's, you know, I was one of the first people from my generation to graduate from university. So that was a big thing in itself. And it's just like, well, get up, keep going, like, come to church. You know, we'll put in a prayer request for you. What are you going through? And I'm like, oh my gosh, like, at the time, I didn't realize it. It's the lack of education, lack of knowledge about the symptoms, things to look forward to, to look out for. It's the lack of education with, you know, family members and being able to identify, you know, what are the signs and symptoms of, like, mental health challenges. You know, so those are just a few things that came to my mind as I was watching that clip.
Thank you, Nikki. Thank you very much for sharing all that. And it's true, we can do so much more with the church. It's a good gateway in some instances. But I really liked what he said about it being more like a triage spot. So a place where you can identify that more is necessary than just prayer. And that if it were possible as well to make it a place that was safe to express the fact that there is more than I need, and then a place from there to go to get that more that is needed when it is necessary. Thank you. And anyone else? Hi.
Hi, Kimberly.
Yes,
I made it. I cut part of that clip, but I got the essence of what he was speaking on, and he touched on several good points, because as you're saying, you know, the church can be used as a triage, and I think, excuse me, one of the good points he really made was putting the onus on the church as an actual provider to be culturally competent. And a lot of times in church, what happens is a lot of individuals in church go to the pastor for counseling or marital advice, hoping that pastor is competent enough to be able to counsel. But unfortunately, a lot of times they're not competent. They don't have the skills and the training to consult someone on marriage or tell someone, or diagnose them. So I think it's really good that he did bring that point up, that, it's on the provider to become culturally competent. And that doesn't require a minister to go to school to become a social worker or a therapist, but there's other smaller things they can do, such as attending first aid mental health training, or first aid, in terms of, you have those individuals there who can do that. And another component is, there's a lack of premarital counseling within the Black community, right? So when you do, when a family does finally want to come and, think about getting married or want some advice, they go to a pastor who says one or two things, right? If you're living in the same house, get married. That's the advice, coming from the pastor from the old church. Get married, living in sin. But there's more in between than just telling someone to get married and ruining that person's life even more when they're marrying someone who they shouldn't be married to. So those are just my takes from it. And I think he made some really good points on putting the onus on that provider, which could be the church.
Absolutely. Thank you. Welcome.
I think I'd just like to add to that. I totally agree with regards to the role of the church. I think we need to also, as a Black community, really go back to the beginning and say, look, when we're talking about trauma, we've got to recognize that as the system goes, is that we don't allow ourselves the right to be ill. We don't allow ourselves the right to be mentally ill, let alone ill. We're ill, we're going to work, we're sending our kids to school because the social economic status in our family network is that the child has to go to school because I can't take a day off because financially it is what it is. So the video, when it's talking about the urban experience, we also need to recognize that when not all of us are coming from an urban experience. And what does that look like? So then how do we give ourselves the right to feel, I need help, how do I get help? The second thing is that whole, the cape, I'm the Black warrior, I can do it all. No, well, what happens to our boys that are even more challenged with identity? I'm a male, what does that look like? And so when we allow ourselves to be forgiven, when we forgive ourselves and allow ourselves to be human, then we can start allowing ourselves to really get early intervention. And then what everyone has spoken of, and especially the young man, Nicholas Prince, talked about early intervention, the fear of letting go, the fear of losing control.
That's right.
That is the first point of fear when a person feels.
Sit back.
Yeah. Oh, I thought you said it to me.
It's all good.
I thought you said sit back.
No, it's all good, honey.
It's okay. But yeah, it's even down to the point of what is urbanization? What does that look like?
Yeah.
To the stereotype, poverty, drugs, and it is impacted. But what happens when we are dealing with upward mobility? Upward mobility is a totally different thing. What are we talking about when we talk about children with mixed heritage or mixed identity? We're no longer one. We are so much more than that. And so as soon as so when you talk about education, we've got to talk about the challenge that we have is that we need to educate that we are of trauma. We are our history of trauma. We're generationally traumatized, and then they go through the experience of who am I? Then they've got to work. Then as young people, they have to then fathom out, well, what's the gender? What's the sexuality? What's the preference? What is this whole acronym? So then we get to the point whereby when he says the service isn't their service is not meeting the needs. How do I provide therapy to individuals when I'm not looking at who you are? So as a clinician in university, and I'm seeing, you haven't even asked me where I'm from, but you're giving me therapy. The clinicians I work with don't even want to talk about racism. So when I bring it up, it's a case of, well, why are you being a troublemaker? What is that? And then I'm sitting in front of a child that is also struggling with their own mental health, or a grown woman or a grown man who's lived all his life. And a part of that mental health is challenging as to who am I? Who am I? As in culturally, who am I? Systematically, how am I perceived? And then where is the equitable access to services? What does that look like? When I go for pain, what do I get given? When my colleagues or friends go for therapy, it's okay for someone who is not of visual minority or not Black to access mental health services. It's fashionable. You hear it.
Yeah,
I'm in therapy. And I'm like, oh, you are? As in, but then when a Black person says, I'm in therapy, it has an alarming
yes.
It creates fear, it creates an inability. So when schools are responding to that stereotype, and we parents are unable to voice and advocate because we're living from a victimization.
Yes.
And I'm conscious of saying victimization, but I'm more inclined to say when we haven't found a way to empower our own selves, to call it what it is and to ask for the help that we need. We're in a cycle of, we've got so much work to do, like Lady Janelle Levy said. But the fundamental thing about that film, about the clip, was that recognizing that what we need is different.
Yes.
What our sons who are mixed race is different. And so how do we even empower those family members or individuals to support someone who is of color that is not of the same race as themselves? Like, how do I identify with them? And so this is a well down packed issue that we need to accept and very much advocate that, yes, we have a need and we require a service that looks like what we need.
Exactly. Thank you. And it is, it's multi-layered. Thank you for sharing that. Who's chiming in? Go ahead.
Sorry, I just wanted to quickly share. I'm sorry to cut you off. I just didn't want you to move on to the next thing and I didn't get to speak. So I basically answered two of the questions, which was how has trauma silenced me and how has being strong impacted me. So the first one was I answered for how has being strong affected me. I had to write this down.
Awesome.
I'm not gonna remember. Okay, so I put how has being strong affected me. Number one, I have a learning disorder, and because of that, it is hard for me to be articulate and super smart like Michael Eric Dyson and Austin Channing, or like my other students in class. Number two, I feel as though I have to provide for my family all the time. Make no mistake, it's a blessing to be able to take care of those that are around you. But sometimes I hardly have any money for myself, so I can buy the stuff I need to buy the stuff that I need to buy in order to take care of myself. Three, I have to be on like a light switch. My brain has to be sharp when I'm at work. There is no room for mistakes, for I am a Black woman. After all, we are the most educated, apparently. And the last question was, trauma has silenced me by being afraid to speak my truth since I have to be smart as a web all the time. Trauma also has affected me with how I talk a certain way, being labeled as an Oreo. And also trauma has affected me by not being proud of where I come from, since the media prefers someone from the streets of the Bronx and Compton, like they prefer street hoodlums. And lastly, trying to navigate the waters when trying to make friends with others, because I am afraid of anyone lashing out at me for being too nice or for even trying to make friends, which has happened. So yeah, that's it. I just want to share that.
Oh, bless your heart.
I don't
Thank you, advice. Thank you so much for sharing that. And it's true, I can hear that there's so many different things that can stop us from reaching out and disempower us from speaking our truth. But the fact that you're able to write it down and speak your truth here warms my heart, because it's in the speaking And it's in the continuation or the continual asking that we receive the liberation that we seek, right? So as I said earlier, keep knocking, keep asking, and know that there is an answer specifically for you, right? And I know we've talked on a number of occasions, and I'm always encouraged by your willingness and your ability to speak. And by no means do I consider you inarticulate. You're very articulate, very much so. So I applaud and I thank you for sharing.
Oh, thank you. Because I don't. I feel like I'm not, but thank you.
No, you are too. You are too. Anyone else from the panel? Did you have a response to this clip? I'm cognizant of the few have not yet spoken, and I'm just making sure that you haven't spoken because you have nothing to say, or I shouldn't say nothing to say. You're not wanting to speak at this particular clip? Maybe
Canada wants to talk. Canada.
I'm coming to you now, Canada.
Oh, okay.
Thanks for that. Oh, you're muted though. Are you gonna, oh, there you go. Hi.
How are you? My name is Lourdes Fuentes. I'm here in Toronto. I'm a founder of the Canada Nos Une. It's a multicultural organization. Thank you to put this. I love to share with all of you because community is all together for me. I'm a plastic artist and coach facilitator of social cultural well-being and integral health for entrepreneurs of being you, right? That it's my propose to stay here with all of you because in this community in Canada Nos Une and Taller Talento Artesano, we involve all communities. I'm a volunteer for Davenport Perth Community Health Center for many years and work with the Club for Boys and Girls and other organizations and church. And I'm glad to hear all of you because I'm a Latin and I have the same approach like you feel, right?
Yeah.
It's same for the Latin community, have a discrimination and have a different kind of issues. But always what I try to put on the table is that we are the same. Land is one. We have many continents in the earth, right? But
yeah,
we are the same people. And looking as if I am a Latin, you are Black, or they are Japanese, or they are. It's not that we need now. We need to open mind, right? And see we are unique persons and everybody have issues every day. We know to stay healthy is the most important and to need to work because we need to support our families, put food at the table and things like, right? When I hear, oh, something happened or it's a Black or it's a Latin from Mexico in a specific because about Latin, they put
your sound is
okay, wait, I'm back.
Okay.
I'm here. Okay. Yeah, but the most important thing is like you say, Kimberly, that we need to put out your feelings. If you write down, if you talk with somebody else, looking for counseling, looking for coaches, looking for organizations that you help others and put that feelings that you have, because I'm crying like you every day because barrier for me was the language and my Spanish is coming, right? But for me to have a good English is not now after 10 years in Canada. But I cry like you every night to say how I'm gonna feed my kids, how I'm gonna help other people, how can I go and find a good job? Because when you are a migrant, and I was manager for selling products of baby and good job and come to Canada and clean dishes and do laundry for others and things like. You need to adapt, right? Maybe you're USA or other countries, and it's glad to have you all of here by this platform to share this, because we need to be strong. We need to think we are one. It's not, we need to stop at thinking that because it's our color or it's our community, or I know it's hard to understand this. And I respect whatever you say, because it's very important for everybody to identify as a community. But if we continue putting names at the things, we're never gonna break the pattern that we are under.
Thank you so much for sharing. I appreciate what you shared. And I'm also cognizant that many people experience mental health and barriers and obstacles to receiving help. But we are specifically speaking about the obstacles and the barriers that are put in front of Black people, specifically in this particular group tonight. Though I am cognizant that there are barriers across for everybody in achieving assistance. But this particular speak is really directed to the barriers that are specific in this part of the community that that has disproportionately impacted the Black community as they attempt to reach out for assistance, if at all, and the shame and the barrier that comes with that.
I work with all of your groups here in area Davenport, and I talk with the kids and it's motivate them to be the person that they want to be. And
I don't mean to cut you, but I'm cognizant of the time, and we've got a number of more clips to go through. But I really genuinely appreciate what you shared. Absolutely.
Kimberly?
Yes.
Can I say something really quick, really fast? I know we're pressed for time.
Yeah,
I just want to speak really quick to Danny's comment, just on the word choice she's using in terms of not being, feeling that she's not smart. And I think that's another thing that, you know, in terms of potential stigma is looking at smart looking a certain way. And if you don't look a certain way, then you're not considered smart. And I just want to let you know that, you know, there's smart looks several different ways. You know, there were several different geniuses who had mental conditions. And many geniuses were neurodivergent, which means your mind thinks differently. So people who are autistic or have ADHD, these are things that are conditions that not necessarily are bad, but you're neurodiverse, meaning you think a different way. So I just want to just put that out there, you know, to, you know, so you can maybe use those choice of words and saying, you know, start talking to yourself, saying, I'm, you know, the way I think is diverse versus I'm not smart enough. You know, stigma is thinking smart looks a certain way, and artists are, some artists hold on to their conditions by, you know, putting that in artistry, and a lot of them may have mental conditions. So I just wanted to put that out there.
Awesome. Thank you. Thank you, Christian, for that. I'm going to share my screen, and this is the next clip that we're going to step into, a clip that's specifically about shame. I have to unshare and then reshare. Just give me 1 second. As I come into that, go into this. There we go.
So, first of all, let's just talk about shame. You've studied it.
I did.
Not me.
Can we all hear and see this?
Yeah.
Excellent. Excellent. Okay.
Many people have studied it.
No, in fact, I wanted to study it, and a lot of people said, no, don't study it, don't study it. And then I was kind of a rebel rouser, you know, a little hellraiser. And so I said, oh no, then I'm going to study it definitely if I shouldn't study it. And I go to the stacks at the library at our college, and the first article I pull says the decision to study shame has been the death of many academic careers.
Oh my goodness.
I was like, student loans, death of the career. I'm like, oh my God.
Wow.
Yeah, you know why?
Why?
Nobody wants to talk about it.
Yes.
We have a visceral reaction to the word shame.
So you say that if you're like on an airplane and somebody say, oh, what do you do? And you say, I study shame, people, they literally turn the other way.
I have answers based on whether I want to chat or not.
Yes, and the
I
answer.
I study courage. Oh, yeah. I study shame. Oh, these angry birds are fantastic, aren't they? And that's it. Wrap it up.
Yeah.
Yeah. You know, the 1, 2, 3 is about shame. We all have it. It's the most human, primitive emotion that we experience.
How do you define it?
The intensely painful feeling that we are unworthy of love and belonging.
And does it occur after a particular incident, or does it occur over, you know, many life experiences?
Both.
Both.
It could happen in an instant. You know, there are specific memories that we can recall that can bring up shame for us. But there are also very insidious, quiet messages that we just marinate in over a lifetime.
This is what I've always known about and tried to get across to people, and don't think I was successful at it really, in the 25 years of the Oprah show. The thing about abuse, and particularly sexual abuse, most people think it's about the sex. It's really about the shame that occurs after the sex, and it's keeping it the secret, and we're only as liberated as our secrets. And the secret creates the shame, and you end up feeling like you're a bad person. And it's the shame that damages your life. The actual act itself, people can get over that, but it's the shame that you carry with it.
There is no question in my mind.
No
that's
question
truth.
about that.
That's just truth.
That's
like God truth.
Yeah.
I think shame is lethal. I think shame is deadly. And I think we are swimming in it deep.
Do people recognize it
No.
though? I think people don't recognize
So people have 1 or 2 reactions when I say shame. They
Yes.
say, I don't know what you're talking about, but that has nothing to do with me.
Yep.
I know exactly what you're talking about, and I'm not talking about that. But here's the bottom line with shame. The less you talk about it, the more you got it. Shame needs 3 things to grow exponentially in our lives: secrecy, silence, and judgment.
Yeah.
So you put shame in a petri dish.
Yeah.
And you douse it with a little secrecy, a little silence, and a little judgment. It grows exponentially. It will creep into every corner and crevice of your life.
And shape all of your...
Shape everything.
Shape everything. The way you think, the way you think about yourself, the way you think about other people, the way
Everything.
you interact with other people, what you do, the choices you make, who you marry, all of it.
Yeah. You put the same amount of shame in a petri dish, and you douse it with empathy. You've created an environment that is hostile to shame.
Wow.
Shame cannot survive being spoken. It cannot survive empathy. So if I call you, if something really shaming happens to me,
and you talk about it,
and I call you and I say, oh God, Oprah, it's Brene, you're not gonna believe what happened. I'm in such deep shame. And you say, what's going on? And I tell you, and you express empathy.
Yes.
Shame can't survive it. Shame depends on me buying in to the belief that I'm alone. You know, I have a good friend, Robert Hilliker, who I work with, and he's a therapist, and he always says, hey, keep the shadow up here because it can only take you down from behind.
Whoa, that's good.
Yeah.
Hi, everyone. So what are people's thoughts on that clip? I'll tell you one little thing. Every time I watch that little clip, Michael, bless your heart for sharing that the other day. I've watched it a multitude of times since. And I've watched the whole episode on numerous occasions. But this little clip really honed in for me. And the fact that shame can only survive in secrecy, silence, and judgment, and that the antecedent to shame is empathy really resonates with me. And I'm wondering if that resonates with any of the other panelists. And I'm cognizant of the fact that Medina, I have not really heard from you. And I'm wondering if you wanted to share something on what Brene Brown just had to say.
Yes. Can somebody else go first, please?
Yes, absolutely. No pressure. Who else from the panel wants to share?
What resonates for me, Kimberly, is the idea that shame should be held up here and brought into the light. I love that quote. That was just perfect. Working with ex-offenders and people in prison in England, they are shunned by society. And as a result, they feel a lot of shame. They carry a lot of shame. And by talking about it, by doing therapy, perhaps by doing narrative therapy and writing, they bring their shame up here and they are able to then process it. And it's been really transformative for them. I'll hand over to you, Medina.
Yeah, okay. So I think, yeah, I really resonated with that too, because I think when they were discussing how like shame only like thrives off of like, the belief that it's controlling you, I think that's like really like prevalent in my life. And I think with a lot of other Black people who've experienced racism on the daily, and to like walk around in a very, in a sense where you have to carry your identities and the implications of that when you're surrounded by people who I guess like a very toxic environment around you. And I think from my experience as a student and, you know, always predominantly white institutions, there's always that, I think, recognition that you exist as a Black person in that space. And when you see something that doesn't like sit right with you, you have to carry that. And I think this is in like the Black Student Union that I'm part of. This is a discussion that we have a lot on how we're often gaslit on our experiences and made to feel like it doesn't exist. And I think that's really shameful, because now you doubt your lived realities, and you doubt things that have actually happened to you, things that are traumatizing. And that's like mentioned the thing with Oprah, where if you substitute like a rape with like a very like a violent act of racism, is it actually that act that like is making you feel horrible, or is it the fact that nobody believes you about it afterwards, or you don't know how to interact and cope with that? So yeah, that's sort of my thoughts on it. I think it's really interesting to think about how we have to engage with those feelings and engage with interactions, and specifically how as Black people we have to walk around and carry that, and we're being told that we have to internalize that, even by default, even because it just isn't the space that we're given, and we have to create that space with forms like these. So yeah, I'm glad that we're having that.
It really, that secrecy piece, that you know, having to, particularly as an individual who's surrounded, whether it be working or interacting in predominantly white spaces, and having to cap and silence my experience because it is gaslit if I speak, or there's jeopardy of retaliation if I speak, or jeopardy of losing a position or my finances, or all of those things if I do speak. So that shame becomes the, silence becomes the dominant response that genuinely feeds shame. And so it continually grows because you're not in a space where it's safe to speak about the thing that is causing you distress. And the less you are able to speak, the more you are silent, the bigger that shame becomes, and it just becomes a wretchedly vicious cycle. So yeah, this in particular, this little clip has really resonated with me. How about you, Nicola?
Oh, wow. Wow, that you know it does.
I know.
Straight away, like, because I've spoken many times about the jihad window of how we self-compromise or show up half of ourselves because of the upward mobility. So here we've got, taken last year, we've got Floyd George on the neck, we've got whole outburst, and then people in positions, Black people in positions, are fearful of speaking out against the situation because in fear of their job, fear of being the troublesome one. And now they're faced with a situation where their organizations are saying, we need you to pour in, we need you to speak out. And that's happening across the school board where they're going to their Black teachers saying, tell me your experience. They're going to the Black people saying, well, tell me what your views are. And I'm having to educate them and say, well, this is the first time for these children that they are being asked to really show up for themselves and speak on their behalf as to how they feel about the representation in the school. And what we need to do is support children and support people in positions of power, advocate for themselves and wholeheartedly exist in their true identity and their truth. And so when I hear this, and, I'm always saying that, isolation is mental health's best friend. And as long as you hold that dear, you'll know to run in the opposite direction of isolation, because that's what we do. It's human behavior to isolate ourselves because of, can that therapist or can my mom, or I've been often had hold me, contain my stuff, because my stuff might be too big for you. Yes. And so that is where sometimes the mismatch as a therapist comes, in a sense, the person is carrying around such a story, whether it's university, whether it's in school, whether it be a teenager going to the high school and it's new and it's now online. How do I speak up when the teacher's saying, yeah, man, and it's a white teacher? It's like, hold on a minute. I said, so I'm now speaking to my daughter saying, well, what did you say? I don't really want to talk up about it. So she's showing up with half of herself. Because what she's doing is subjugate her, is marginalizing her own self. Because of not the fact that he said it, but it's the impact of not being able to speak out. And that is the trauma, and that is the post-traumatic stress. When you're in a workplace, when you're being like, patronized, or I don't see it that way, and you're a minority, or it's not, or interculturally, your Black peers are not speaking up or supporting you, or seeing when it's blatant. So you are double-edged in a position, and then how much, and sometimes those allies sometimes are not our own. It's someone else who just like Canada knows, I don't think I know. Spoke like, you're from South America. How do you relate to that? Well, it's all about speaking up, standing up, and acting on the subject in the here and now, because many times things pass, and when you equate the amount of times you've had to deal with not showing up for yourself or not speaking up for yourself, and then isolating yourself within a group where you should feel comfortable, that's a reoccurring cycle of self-harm. And it's an emotional self-harm that we internalize for ourselves that we can't sometimes find into words. And that is the alternative Michael narrative. That is giving you a voice through a different meaning. When I can't find the words to explain the pains that I'm actually feeling, let me have some art, let me have some drama, let me have an alternative expression. Because I'm not being able to be seen. And when I say to Danny, I see you. I need to see you. I see you. And I think a lot of the time we are not showing up for ourselves. We're not calling out for ourselves. And we need to, I also recognize how hard that is too, because it's part of a new world where people are saying, we want you to, but only and then mental health, I want you to show me your mental health, but as a therapist, I don't really want to deal with that right now. Like, what do you mean? This is my story in my story. So,
and it's interesting with mental health when you finally do find that identified safe space to go in and share and speak, you're very cognizant of the fact that you've been carrying such a tremendously heavy load that therapists genuinely, for the most part, they can't carry it. They can't carry it. They can't hear it. They can't contain it. They have no space for it. And so there's that challenge as well. I see your hand there, Barbara, and you can unmic and share your piece.
Yeah, thank you. I am not a therapist or have anything to do in the whole mental health field, but I am a foster mum, and I have lots of kids, especially kids of color, Black, come and stay with me who are dealing with degrees of shame and are not clear on, or not sure how to articulate that. They're dealing with the shame of the parent, they're dealing with the shame of the trauma of what's happened to them. They're lost in trying to find their identity, trying to understand who they are as, especially Black boys. Most of the kids I have are Black boys. And, you know, they're teenagers who have just lost, mentally just lost, and so sorrowful. When I think about especially one particular young man, and Nicola knows this particular child who was with me, and what he was coming from in respect of the abuse, abandonment, etc., and then having to go to school and everything was a lie. He could not be truthful. And even though he was having therapy, and even though he was meeting with a counselor on a weekly basis for a very, very long time, he could not talk about his shame. He didn't know how to identify or to express it in a way, because it was so deep rooted. And so, you know, how do you help, especially children? I mean, I think as we get older, we make choices about whether or not we want to deal with our shame and we want to do something about it, right?
Yeah.
I mean, this is just my opinion. So, you know, please, therapists, do not shout or scream at me if I say something that might be not right. But I just want to say that, you know, okay, I'm just nervous with all these therapists.
Don't be nervous. Come on now.
But I just want to speak from my heart that, you know, how do someone like me, right, who might know someone, or someone who is taking care of young children who are dealing with all types of shame, right? How do we help them to navigate some of that, or bring them to a place of recognition or acknowledgement, or can express themselves in a way that makes sense? I mean, the challenge with most Black kids, especially Black kids in our children's aid system here in Canada, is that there is not enough representation, right? And when you ask for, I know in my case, when I've asked for a Black therapist or someone of color to be able to relate to this particular child, it's, we don't have the budget for that. We only we can only speak to someone who's free. They're not charging us for their services. I'm like, really? You know, you're not paying for any of this? So it frustrates me that there is not enough representation, but how can we navigate some of this? And someone like me who's not experienced, who doesn't have any formal training or anything like that, how do we speak to the problem?
And there's a multitude of people on the panel, I think, who can actually speak to this, but the thing that's resonating in my heart right now is that the only thing anyone can really do, therapists, foster parents, is create a space that is safe. And that's it. The time for the individual to feel safe and step out of their shame and speak is entirely up to them. And they're absolutely in control of that time of release. It may come with you and in the space that you create, or it may not. But creating the space is a necessity. But prying open that nut is something that that individual has to do. And it happens genuinely because the safe space and the opportunity and the actual internal assurance that they can speak is created in them. But on the outside, we have control of only the creation of that safety. And so insofar as you do that, you're doing the right thing. And just, I've had the great fortune over the last 25, 30 years of working with various people who have been heavy laden with shame. I've had the great fortune of seeing a multitude of people released from that shame in their time. But I've also seen a number of people who did eventually find release from the shame, but not in the presence of safety that I created. They were able years later to find safety and do it for themselves, and but not always in my presence. So if the creation of the safety and the desire to do that, the end goal needs to be the creation of the safety. It cannot be that you must see the release from shame, because that will set you up as a therapist, as a foster parent, as a parent, as a loved one for internal challenges.
Yeah, and I mean, obviously I'm not advocating that. For me, it's all about
absolutely.
How do I mean, obviously I've done this a number of times, so you create that space environment of trust, and you're there for them irrespective of whatever it is they're going through, right?
Yeah.
So I get that and I understand that, but sometimes it's very challenging when you can see the pain, right?
Yeah.
And it's being expressed through debilitating beliefs, behavior, aggression, and just this lack of respect or disrespect for themselves and for life in general, right?
Yeah.
So it's hard to see it and not feel something for it, right? I mean, I hear what Brene Brown was saying, that, you know, empathy, the thing that she said about empathy, which kind of was like, whoa, that kind of shocked me a little bit, because that's the first thing you feel.
Absolutely. Well,
right?
Yeah.
So anyway.
Absolutely. Yeah. I see hands. I saw your hands first, Janelle. And then Swetha, you're after Janelle. Janelle, if you unmute and share.
Comment will be quick, and I just wanted to jump off of the point that I also agree with what we're talking about and what Brene Brown said, that there's just so much power in empathy in terms of what us kind of like non-therapist people can do. And I think one of the things that I learned recently is that sometimes people mix up sympathy for empathy, and sympathy is feeling sorry for other people, but empathy is really attempting to feel what other people feel. So I think that that's a really important tool that we can all use, and that there's also, Brene didn't really mention this, but I think fear plays a part. I know my parents used to always say fear stands for false expectations appearing real, because I think part of the big struggle with having mental disorders is not even so much the disorder itself, it's the fear of what's going to happen. And I think fear and shame can be interlinked. And just like Brene said so beautifully, I think empathy can crush both of those things.
Absolutely. Thank you. Absolutely. Swetha?
Hi. Well, I do agree with what everybody else had said, especially with Brene Brown. And a big piece of that I wanted to highlight was especially on the shame on neurodiversity. And when, for example, when I'm working, I work in Toronto, and when I'm working with a lot of young Black boys, I've noticed that in the school system, and especially in terms of psychoeducation, there's a big overrepresentation of young Black boys being diagnosed with ADHD. And I wonder how much of that is a psychological diagnosis or how much of it is a bias that's influencing the assessment. And yeah.
I'm sorry. Absolutely phenomenal question. Yes, carry on, sorry.
No, it's okay. And I really I admire how you resonate with that, because it's very mind-boggling in the school system, because there's that shame that the parents are now faced with, which is now your son or your daughter has ADHD. Now, what happens on the other end is that for those who might not have the awareness or limited awareness, it's the tough love approach that's being given.
Yes.
Right. And so what I've noticed in school social work is that when we're talking about anti-Black racism, there are social workers who have said that because they don't work with Black children, they don't need to take part in it. And so now I wonder, how do we create a holistic way of building those conversations, especially within the education system that is Eurocentric and white dominated?
Yeah.
And so when we're talking about shame, how as allies can we create those safe spaces to open up these uncomfortable conversations? And also, especially with other racialized communities, to create that holistic allyship. So that way you have a much more a solid foundation to hold spaces for Black bodies as well.
Yes. Phenomenal questions, honestly. And it really is a systemic approach, is necessary. And it kind of ties into what Barbara was saying, that when you go to the, you go and you seek the culturally specific therapy and treatment that the youth you're working with require, you're told that there isn't enough funding for that, and we're looking for free services and or services that are already. No service is actually free, and if it's free, it's actually being funded. The problem is that they're not generally funding culturally specific services. They're funding the white dominant services that that they're comfortable with, and therein lies the problem. So we have our youth, as you say, being identified as all manner of different labels, or the kissing of the teeth is seen as something other than just an expression, and they're labeled as a result of that, and it's just a continuously vicious cycle. So it really is about strategically taking down the system that has continuously and historically oppressed our people. That's the only way we can come out from under that. That's the only way we can come out from under that. Now, I appreciate everybody who has been, and we're like way over time. I'm so sorry, everybody. I'm not a really good time watcher, and I see it's already after 7. And I had another video to show, but I'll save that for next time. So some questions that I've seen in the chat, well, firstly, I need to apologize because I'm not really good at reading the chat. So what I always do is I save the chats and read them after. So if you've asked me any questions or made any comments, I apologize. I will not answer them now, but I will answer them eventually after I've had a chance to read them. But I did catch a couple of them. One was about this recording. And yes, I will share this recording with those who have attended and those who have signed up. In addition to that, it will sit on my YouTube channel. And so you'll be able to access it there. And then the other thing, we will of course be doing this again because we continually run over time and have much left to say. And so we'll do this again for sure. And I think those are the only comments those are the only ones that are staying in my head right now. But I want to share my screen. And this was whatever. Here we go. Nikki, if you're still here and you're able, if you would close us out with your meditation. And before you begin, just thank you, everybody who joined, everybody who shared, everybody who has lent their space and energy to this discussion. I genuinely appreciate you, and thank you for doing so. Nikki, if you could close us out, that would be delightful.
Sure. That was such an edifying conversation, and there were so many points that I didn't get to speak to because I think you're talking about shame, but I feel like intersectionality plays a huge role here, and there are so many different layers, so many different directions that we can take this into. So thank you everyone for participating. This was a very, very edifying conversation. Okay, so.
Wait, before you start your meds, how do we know when the next one is? Like the next session?
You're muted, Kimberly. We can't hear you.
What?
Okay. I'm sorry. Thanks, Nikki. I'll be sending you an email, and I'll be speaking after the meditation as well. But I'll be sending everybody an email with next dates, next times, and once you've signed up for this event, then your email comes to me, and I will send you out links and information as the video is completed. I'll make sure that you get it, and then I'll also let you know when the next date and time is. Thank you for asking. Any other questions you can put in the chat, and I promise I will read them. But we're just going to close out in the meditation, and then after Nikki has finished the meditation, I'll just say a few goodbyes and comments and things. Thank you, Nikki.
Okay, you're welcome. So on speaking about shame, one thing that has helped me in working through shame is changing the narratives that I tell myself. And I do this through reciting affirmations. So affirmations are positive statements that help us to counter negative or unsupportive thoughts. So I'm gonna take a moment to guide you through an affirmation meditation. Again, just as earlier on, if at any point during this exercise you feel uncomfortable, please feel free to sit this one out. There's no obligation to participate. Okay, so get into a comfortable position. You have the option to close your eyes or you can lower your gaze. Totally up to you, whatever you feel comfortable doing. You can place your left hand or any hand, it doesn't matter, over your heart and your other hand over your belly. And just take a moment to check in with your breath and your breathing. Not judging it or anything like that, just observing it and allowing it to just be. So I'm going to recite an affirmation, and you can repeat them quietly to yourself or out loud. And we are going to be breathing in between each affirmation. Okay, so let's begin. Repeat after me. I am safe. I am loved. I am supported. I am deserving of love, safety, and belonging. I am deserving of self-compassion. I am worthy and deserving of support. I am releasing all shame, guilt, and judgment. I am releasing all thoughts and situations that do not serve me. I am greater than my circumstances. I am healthy, whole. I am a divine being having a human experience. When you're ready, feel free to open your eyes and return back to the room. I invite you to spend a few minutes either at the beginning of your day or at the end of your day to engage in this practice. You can do so with your own affirmations or with the ones that I shared with you all tonight. Thank you all so much for participating. It was a pleasure to be here with you, and be well.
Thank you so much, Nikki.
You're welcome.
Thank you so much. So, in closing for this evening, wherever you go, no matter what the weather, always bring your own sunshine. Step out of where you are and step out of what has held you back, and know that you carry the ability to infect and change whatever environment you stand in. And so I'm very grateful for your participation today. I will continually keep you informed of when we do speak next, when we do gather next. I promise to go through all the items in the chat and and answer any questions, respond to any comments. And I'm so grateful for all that y'all did share. And I will also post the video after it's processed. And I think that's it. If you have any questions, this is my information. I'll also share this PowerPoint, and that will give you the contact information for those who were on the panel. Panel members, thank you from my heart. So genuinely, I thank you for all that you shared and for your willingness to be here. And I'll be talking with you after this as well. But that's it for now, y'all. Thank you so very much. Any questions, any comments? I see hands. Are they hands from before or are they hands from now? Thank you. Well done, Nikki.
Thank you. Thank you. Thank you, everyone. This was so needed.
Yeah, absolutely. Thank you, Michael. Thank you very much. We'll get to the other videos next time. We got to 2 this time. I'm getting quite impressed.
It was, bye-bye.
Yeah. It was what, Miss Nikki? Nicola?
It was good. There was so much to talk about. It was crazy.
Honestly, there was way too much, and I think that's a testament to like the importance of these spaces to continue the conversation ongoing. You know.
Yeah, absolutely.
Hold on, you've still got people with us. We just didn't see.
Yeah.
Oh, bye-bye. Bye, everyone.
Bye, everyone.
No, so thank you so much for that. Really was fantastic for all the comments, and the videos were really good. So thank you so much.
You're very welcome. Thank you.
Thanks, Dom.
Bless
Bye.
you. Bye, honey.
Thank you very much.
You're very welcome. Thank you.